caregiver outside of class?
Outside of class, over the summer, I had a nannying job, so I was in charge of watching a 6-month-old child till the end of summer.
I actually became a CNA at the beginning of this year, and I worked in a elderly daycare center over the summer while I was not in school.
Can you tell us your name?
My name's Garrett Campbell.
Great. And have you been in a caregiver role for an individual who is disabled or has an illness?
I have a 5-year-old daughter. She doesn't have any disabilities, but
It's definitely caring.
Yep.
When my son was born, he was very sick. He was flown to Johns Hopkins, and when he came home, he had a colostomy for 5 months. So I had to be his caregiver. It was my first child, and it was very difficult to have a first child and have that caregiving role where it was so much greater than just, feeding your child and doing the normal things that are already stressful.
Yes, I helped take care of my grandmother.
How did that change your prior perspective of care?
there's a lot more things that you need to take into account for than most people just think about on a day-to-day basis. They don't realize all the little details that have to be paid attention to.
I think that you need to have more patience than you probably think until you're in the given situation.
I think it changes you because you really understand how difficult it is and how much time it takes. Every little thing takes so much longer than you really think, and it's every day, 24 hours a day, and you're the one person that's responsible for another human.
What is your idea of a care manifesto? If you could change something about the idea of care, what would it be?
I think that there's a lot of programs out there where you can ask for help, or that you can maybe talk to somebody else to walk you through it. I was lucky. We were at Johns Hopkins and the nursing staff there was fantastic. So I could always call them. I felt like I had somebody I could reach out and talk to, and they could walk you through just something as simple as changing a colostomy bag on a 3-week-old child is really like time consuming, and it's scary. It's really frightening. And I think that people should realize how difficult it is for the caregivers, whether it's a child, whether it's yours, whether it's a parent.
People need to understand it more and turn care into compassion.
I think that a lot of families take on the responsibility of caring for the elderly because of the terrible things you hear in the lawsuits that happen in nursing homes. So if there was a way to prevent those things from happening, I think that it would help.
I think definitely the biggest thing is putting the patient first, making sure you're taking care of the patient. Nurses have a lot of things to do, but the patient is your top priority, so giving them their care and meeting their needs first is definitely the most important thing.
What will we do when we get old? Will we walk down the same road? Will you be there by my side, standing strong as the waves roll over?